Thank you everyone for coming this morning. Excellent turnout. I have the pleasure of welcoming you both to Grand Rounds this morning, as well as to the start of our No Hit Zone Conference. This is our second No Hit Zone Conference. I don't know if any of you all attended our first one, but our first one was back in March of 2016 when we launched the first hospital-based No Hit Zone in the state of Minnesota. So we were quite excited. That was the day that we received and announced the gift that also made us the Otto Bremer Trust Center for Safe and Healthy Children. So it was a great day on two counts. And for those new to the topic of a no-hit zone is an environment where adult shall not hit an adult shall not hit a child shall not hit an adult, and no child shall ever hit another child as well. The purpose of a no-hit zone is to create a safe and healthy environment for patients, families, visitors, staff, as well as to provide support, education, resources surrounding effective discipline. And so today, you with both an update on our no-hit zone as well as education by our experts on physical punishment. Our first speaker today, Dr. Elizabeth Gershoff, is a professor in the Department of Human Development and Family Sciences at the University of Texas at Austin. She is a developmental psychologist whose research focuses on how parent and school discipline affect child and youth development. Parent education and early education programs such as the federal Head Start program can improve the lives of at-risk children. She is internationally recognized as an expert on the effects of physical punishment on children. She currently serves as director of the Interdisciplinary Collaborative on Development and Context and as associate director for faculty development and postdoctoral training at the Population Research Center, both at the University of Texas at Austin. Dr. Gershoff has been awarded numerous federal grants to support her research from the Centers for Disease Control and Prevention, the National Institute for Child Health and Human Development, National Institute for Mental Health, and National Science Foundation. Dr. Gershoff will be speaking this morning on about the harms linked to physical punishment and about interventions to reduce it in medical settings. So thank you all this morning. Gershoff.
Okay, let's make sure this is working. It seems like it is. Thank you, Nancy, for that nice introduction and for the invitation to come speak with you all today. So I want to begin by just establishing that spanking and physical punishment are still very common. There's a belief that I sometimes hear that, oh, children are so poorly behaved today because nobody spanks anymore. Both sides of that statement are not true. It's definitely not true that parents don't spank anymore. A recent survey, this is a national survey of attitudes about spanking, and 76% of men and 65% of women believe it's still okay to sometimes give a child a good hard spanking. So that there's still this belief that it's good for children, that it's sometimes necessary. In some research, this is from a study in North Carolina, in a statewide survey, 70% of mothers of 2-year-olds reported spanking their children. So that's a majority of mothers of 2-year-olds. I've done some research looking up to 5th grade. 80% of children are spanked at some point by their parents. So the majority of parents are still spanking at some point. They may be spanking less frequently than they had been in the past, but most parents still spank at some point. And our rate of spanking is actually higher than around the world. UNICEF has done studies polling parents in several underdeveloped countries, and 60% of children in those countries are being spanked by their parents or physically punished. So our rate is actually higher than many other countries. So I want to go through some of the common arguments that you and I hear about spanking when parents are approached. Their first argument is that it works, and I'm going to go through the research on one of these to kind of show you how these arguments are not true. I don't believe there are any downsides to spanking. Spanking is not hitting and certainly not abuse. It is a normal and necessary part of parenting in my culture or community. And I only spank occasionally, and I'm otherwise warm and responsive with my child. So these are all things that I do a lot when I talk with parents. I do a lot of media interviews about this, and I hear all these arguments. And so I've collected the research that we know on each of them to talk with you today. And so I'm going to draw some from a research study that I published last year with a colleague of mine from the University of Michigan. This is a meta-analysis, and a meta-analysis takes all the research that's out there and creates a summary of effect size to characterize between spanking and a range of different child outcomes. So we looked at 75 studies that were conducted over 50 years from 13 different countries, and you can see we had 160,000 unique children in our study. So does spanking improve behavior? That's what parents' goal is when they're spanking, at least their stated goal, is to change children's behavior. And it turns out spanking does not work. It does not make children more likely to comply, either in the short term, right then, or later. It's also not linked with reductions in aggression or antisocial behavior. When you ask parents why they spank, it's often because, ironically, the child was being aggressive. And so you'll hear parents saying, don't hit, swiping at their child, not seeing the contradiction between their words and their actions. But when you ask parents why they spank, it's usually safety or the child being aggressive. Those are the two main reasons parents will spank. And spanking doesn't work. Spanking does not help children learn how to control those impulses, to change their behavior. And in fact, spanking does the opposite, right? It's modeling aggression. Parents are modeling how to use aggression instrumentally, use it to change other people's behavior. Now, of course, the parents aren't very successful, but kids are still seeing that parents are doing that. And so kids think, well, if my parent is using aggression against me, then I can go use aggression with other people when I am on the playground or with my siblings or things like that. Spanking is linked with more aggression, not less. And spanking is also not linked with children learning how to behave morally, ethically, appropriately in the future. And spanking, as I said, is now actually linked with behavior. So all of the research that we've looked at has shown spanking linked with more antisocial behavior, less pro-social behavior, and social competence. And it's important that the findings are incredibly consistent. There are no findings showing that spanking is linked with positive outcomes for children. There just aren't. And I've looked for them. I've read every study ever done on spanking physical punishment, and there's many hundreds of them. And there isn't research out there to support that. And so, unfortunately, there are some researchers in the field who want to perpetuate the idea that there's a debate about spanking, that some researchers think it's bad and some researchers still think it's good. Well, beliefs might be that way, but the data don't support those beliefs. The data only come down on the side of link with negative outcomes. And it's difficult to do really good research on spanking because we can't randomly assign parents and children to spank conditions. But we've done several things statistically to kind of show that if you kind of apart all other differences between people and just have the difference be spanking through some methods, score matching, we still have shown, and I have a paper coming out about this right now, spanking still predicts increases in behavior problems over time. So the data is pretty conclusive and consistent. Now, one thing that parents aren't thinking about is potential side effects or unintended outcomes that could be linked with spanking. And research has looked at several of them. So the more children are spanked, the likely they are to have mental health problems like depression or anxiety, more difficult relationships they have with their parents, they have lower self-esteem, and surprisingly lower academic performance. That link is probably not a direct one. It probably is mediated through self-regulation or things like that. I imagine if you ask parents, would you want any of these things for your children, they would say no. These are not things that they intend for their children. But this is what they're getting if they use physical punishment and spanking with their children. We've also looked to see, okay, well, can you spanking in childhood is linked to outcomes in adulthood? And it turns out that adults who report having been spanked in childhood report more mental health problems, more antisocial behavior, and more positive attitudes about spanking. And so this is to what we call intergenerational transmission of spanking and physical punishment. So I was spanked, I turned out okay, so I spank my children spank their children. It kind of goes through generations. And this is a hard one to kind of counter to people because they think they did turn out okay. And we all do. We're all in this room. Most of us were spanked as children, and here we are. We're all well-adjusted people. But I like to say that we turned out okay in spite of spanking, not because of it. It's all the other things our parents did for us that taught us how to behave, how to do well in school, how to be nice to other people. Those are all the times our parents sat down with us and at the kitchen table and explained things to us. They took us to church. They came to sporting events. They came to our school. All those things parents do, those are all the things that made us turn out okay, not the spanking. The spanking was an unfortunate thing that happened that we kind of got past. So a somewhat controversial question is whether physical punishment and abuse are linked. Are they the same thing? Are they different things? And you can't get beside the fact that spanking is hitting. If you were to ask somebody how to define spanking, it would be very hard to do that without using a form of physical violence, some kind of term connoting physical violence. So spanking is hitting. And family violence experts who've been studying various forms of violence for years believe there's a continuum of violence against children with physical abuse, a kind of recognized physical abuse on one side, and physical punishment kind of on the other side. And so if we think about, there's just this kind of, that punishment can escalate into physical abuse. Parents who are very upset, who are very angry, who are altered by drugs or mental health problems, they may unfortunately escalate physical punishment into physical abuse and injury. And we have data that supports this notion. A very comprehensive review of physical abuse cases in Canada, all of the cases, found that 75% of substantiated cases of child abuse, physical child abuse, started off with intentional physical punishment. So the parents described an event where a child misbehaved, or it was a perceived misbehavior. The parent wanted to change that behavior and just started hitting the child too hard or too long, or used an object that injured the child. And so this to me is one of the most tragic parts of studying physical punishment, is that much of physical abuse starts out as parents thinking they're doing the right thing. They think that they're teaching their children, they're doing something they're supposed to do. And yes, as parents, they're supposed to discipline their children, but unfortunately, physical punishment is not effective, and it has all these potential negative side effects, including physical injury to children. My colleague and I, in our meta-analysis, we also found that spanking was risk of physical abuse. And we found that the effect size, so the strength of the relationship between spanking and outcomes and the physical abuse and those same outcomes, the spanking effect size was 2/3 physical abuse effect size. So that suggests that spanking is linked with the same outcomes as physical abuse, just not quite, just 2/3 the strength of the relationship that physical abuse has with those same outcomes. So that again suggests there's this continuum of violence against children. Clearly physical punishment, as we kind of recognize it in the United States, is not as bad as what we recognize as physical abuse and injury. It's on a continuum. It's linked with the same negative outcomes. It's also interesting to know that several states mention corporal punishment. They call it corporal punishment. It's the same thing as physical punishment. For some reason, in legal documents, they always call it corporal punishment. And several state laws mention it in their physical abuse statutes. So physical abuse can include cruel punishment in Connecticut and Ohio. In this range of states, except corporal punishment. Now that, of course, is a very subjective judgment that a judge would have, a family court judge would have to decide what excessive meant in those states. Excessive or unreasonable corporal punishment in Wyoming. Again, what constitutes unreasonable? But I find it interesting that these states have said corporal punishment can be abuse. That's what they're saying in these laws. Corporal punishment can be abuse if it is excessive or unreasonable. So that's kind of interesting that states are actually recognizing this connection, that many of them are kind of still not there in accepting this connection between physical punishment and abuse. So oftentimes people say to me, well, in my community, culture, or my family, it was very common to use physical punishment. That's just what we do. It's part of our culture. That's how we raise children. And so in our culture, it's great. It works well for kids. And so I've looked at this in research to try to determine, is that true? And so the argument for this is called the cultural normativeness theory. developed by some researchers who were then at Duke University. And their idea is that if a practice is very common in a culture, then maybe it's not, children don't have negative consequences because they accept it and they expect it. So if I misbehave, I'm going to get hit, and that's just what happens. And so maybe if kids have that mindset, maybe it will have fewer negative consequences. That's the argument. I don't buy that argument, but that is the argument. And so they based their theory on some data that they and a few other studies had showing that among white families, spanking was linked with more behavior problems for children, but among black families, that was not true. And so this theory was them trying to kind of understand that finding. And so a few studies did find that, but then many studies since then with large national samples have not replicated that. And so in one study where we tried to test this idea, we looked at data from 6 different countries where parents were asked about 11 different kinds of discipline, and then were asked about children's aggression and anxiety problems, and then kids reported their aggression and anxiety problems. And then we also asked them about how normative punishment was in their community. And it was translated to use whatever the term was that was appropriate for that country or community. And we found that even when children and parents thought that physical punishment or spanking was normative, that it was a normal part of their culture, it was still linked with negative outcomes, just to a slight degree if it was a very normative culture. But the link was still with negative outcomes. It didn't flip around. It didn't become all of a sudden positive and kids are having all these great outcomes linked with physical punishment. That we did not see. We also looked at this within the United States. And in the United States, in research on this topic, people have unfortunately used race and ethnicity as a marker of culture. It's not a perfect marker, but that is what people have been doing. And so we wanted to see if that was true in a large nationally representative sample. Could we see race differences in use and in the outcomes linked to it? And so this is a study with 11,000 children. It was a nationally representative sample of children entering kindergarten in the 1998 school year. And these are the rates of parents saying they ever spanked. You see that most parents are spanking. Of all of the groups, the majority of parents are spanking. Black parents are spanking more than the other groups, and that is a statistically different difference, but everybody's spanking. And so then we look to see, okay, given those differences, are there differences in how spanking in kindergarten predicts changes in children's behavior problems from to 3rd grade? And so we looked at that across those 4 race and ethnic groups, and we found that there was no difference. There's no difference in how spanking predicted behavior problems. It predicted more behavior problems for all groups of kids and all parents. So we didn't see any evidence of cultural normativeness in this United States sample. Another question I sometimes get is, well, I might have spanked occasionally, but I'm usually very warm with my child. I might even reconcile with them right after the spanking and make them try to feel good again, which is a very strange mixed message that parents give to children. And so we said, well, we can look at that with data. And so some other colleagues of mine and I looked in a data set called Fragile Families, which sampled several thousand children and families across the United States. It's not nationally representative, but it is a large sample. And we found that the amount of spanking parents engaged in at age 3 predicted increases in behavior problems, aggression from age 3 to age 5, no matter how warm the parent was. And we divided parents into low warmth, medium warmth, and high warmth, and this warmth was observed in a home visit. And so warmth does not buffer. We found no evidence that warmth buffers the effects of spanking on negative outcomes for kids. The good thing is we found that the more warm parents are, the kids do have better outcomes. They're more socially competent, less aggression. So spanking was definitely linked with bad outcomes, but warmth was linked with good outcomes. So we definitely want to encourage parents to be warm and responsive to their kids, and we want to try to get them to stop using so much physical punishment because that's just not having the effects that they want. So to review these arguments, the argument that it works, there's no evidence of that. Absolutely no evidence, data that spanking is good for kids' behavior. We also see that there are a range of side effects or negative unintended linked with spanking. Spanking is indeed hitting and does increase the chance of physical abuse. Spanking's been linked with negative outcomes across countries and across cultures. And spanking outcomes regardless of parent. So there is just no data, and I'm not cherry picking. People ask me, are you cherry picking the data? No. I have read all of it, and I'm a very honest researcher. I present stuff if it's counter to what I find, and there really is nothing to support the other side of the arguments. Because I go into each of my research studies thinking, well, maybe they're right. Maybe these theories are right, and we just never seem to find support that spanking and physical punishment are harmful or are beneficial. We always find that they're harmful. And so in some places in the world, the research is kind of a moot point. Really, it comes down to a human rights argument. And so countries around the world have accepted this idea that physical punishment is actually a violation of rights under the Convention on the Rights of the Child. And so, there's this convention, and the United States was a part of writing that convention, and we signed it under President Bill Clinton, but we have never ratified it. And so the U.S. called on all countries that have ratified to prohibit all forms of physical punishment because it is inconsistent with children's human rights. And so that means only the United States has not signed or has not ratified that convention. We are the only country in the whole world. And if you think of all the range of countries, we are the only one that has not ratified the Convention on the Rights of the Child. And so we are not committed to reducing physical punishment under this convention. But 52 countries have gone ahead and banned physical punishment in any context, so in schools and homes, in juvenile detention, any setting. And so this is the range of countries. And it started off in the right corner with Sweden in 1979. They were the first country. And people say, oh, it's just those Northern European countries. No, it's not. If you look at this map, or this list, I don't think I have the map. Oh, I do have a map next. It's not just Northern European countries now. So if this is a map of how things stand today, the green countries have banned all physical punishment in all settings, including by parents. So you can see South America, almost the entire continent has banned physical punishment. You can see that there's several countries in Africa that have, most of Europe. And so the United States is, and then there's countries that are committed to prohibition, so they've made a public statement saying that they want to prohibit corporal punishment, and so they're working on getting a law passed in their country. Those are the blue ones. I was actually at a conference in Vienna, Austria last year where many of these countries made a very public statement and signed kind of a big pledge saying that they were going to try to get it banned in their countries. So these countries are not necessarily convinced by the research that I just showed you. They're convinced by the human rights argument, which doesn't go very far in the United States, unfortunately. But in other countries, that's a very persuasive argument. So I keep doing research trying to hope that's going to help convince people in the United States. But the research is moot when you start talking about human rights. Human rights are rights. Doesn't matter what the research shows. We didn't need research to show that violence against women was bad for women, right? We just knew that. We knew that was bad. We didn't have to have research showing us that. Unfortunately, we need to have research that physical punishment is bad for kids for some people in the United States to kind of come around to that idea. So why does this matter for all of you? Why does this matter for people working in medical settings? There's a few reasons that I'd like to present to you. One is that several organizations, including several medical organizations, have taken public stands against physical punishment. So in 2009, I wrote a report for Phoenix Children's Hospital summarizing the research on physical punishment. And these organizations all signed on endorsing this document. And in the document, I basically say at the end, the research is pretty clear, parents should not spank their children. And these organizations, including the American Academy of Pediatrics and AMA, all said, we agree with that statement, we agree with this document. 4 organizations have published policy statements that recommend parents not spank and recommend that their members, which will include many of you, actively discourage parents from physical punishment. So that includes AAP, the American Academy of Child and Psychiatry, the American Professional Society on Abuse of Children, known as APSAC, and National Association of Pediatric Nurse Practitioners. So each of them has a very public statement, you can find it on their website, saying the research is very clear, physical punishment is not good for children, parents should be encouraged not to do it, and our members should be encouraging parents to avoid using physical punishment. Also last year, Disease Control and Prevention released this document, which they call a technical package, although really it's just like a little several-page document. And the goal of this was to describe methods that would be effective for preventing child abuse and neglect. And in it, they call for educational and legislative interventions to reduce physical punishment. So this is the Centers for Disease Control and Prevention calling for legislation to ban physical punishment, which is pretty amazing that that happened. Clearly that happened before the election last year. But it exists. The government has this in writing. It is still on their website as far as I know. This is pretty amazing. It didn't get a lot of attention for some reason, but this is a pretty big deal to have a federal agency say this. Second reason is that parents trust physicians for advice on discipline and other medical professionals, but particularly physicians. So my colleague Kathy Taylor did a study where she asked to rank the sources they trust the most for advice on discipline. And so their spouses and their own parents were their first two trusted sources, but then the third one was pediatricians. So right below family are physicians. And so physicians have a real opportunity to educate parents because they trust you. They trust you for advice. Even though physicians are not necessarily trained in what discipline parents should be doing, they still are turning to you for advice. A third reason is that spanking is now thought of as an ACE, and I'm sure many of you are familiar with the ACE study, an adverse childhood experience. And this is just a little bit of data. This is from a research project that I did with some colleagues at the CDC. So they gave us access to the original ACEs data. And so you know that the ACEs data has shown that the number of risks you have, the number of adverse childhood experiences you've had in your childhood links to physical and mental health in adulthood. It turns out that they asked a question about spanking that they've never analyzed before. And so they gave us all the data, and we broke it apart and put the ACE, these are the 10 ACEs, oops, is it still working? 10 ACEs plus spanking. And so these are all in a regression together, so they're kind of all in relation to each other. Clearly, sexual abuse is bad. It's linked with drug use, moderate to heavy drinking, suicide attempts, and depressed affect. So we were interested in the mental health outcomes. Physical abuse linked with drug use and moderate to heavy drinking. But spanking is linked with drug use, moderate to heavy drinking, and suicide attempts, over and above the links between physical outcomes, emotional abuse, sexual abuse. So spanking has a unique relationship with these negative outcomes. And so again, it's looking like spanking is having the same negative outcomes as these forms of abuse that we recognize are bad for children. So I should have done that before. A fourth reason is that parent-to-child hitting does occur in medical practice, and many of you may have seen it. My colleagues and I surveyed staff at two hospitals, Gunderson Medical Center in Wisconsin and Children's Mercy Hospital in Kansas City, Missouri. And we surveyed their staff to find out how often they were seeing it. And we separated the staff into direct care staff, so physicians, nurses, social workers, and then other staff would be receptionists, food service people, custodians. And so you can see that when we combine whether they saw it a few times a month or almost every month, or a few times a year, 27% of direct care staff, which would be all of you, saw a parent hitting a child at some point in the previous year. So that's a lot of incidents of physical punishment happening at these hospitals. So if you think about it across these two centers, that would amount to 771 incidents of parent-to-child hitting in these two hospitals during a year. That's a lot of parent-to-child hitting that staff don't know how to deal with. Staff don't know what they're supposed to do. They don't know what their rights are. Now you all have a no-hit zone policy that we'll hear more about. And so hospitals that have a policy now know what they can do. We asked them, if you saw it, what did you do? And you could see a high proportion of the staff that don't provide direct care don't do anything. They just don't know what to do. So the vast majority of them don't do anything at all. That's not true for the direct care staff. Only 29% of them don't do anything. Most times they would say they would call security, call social worker, or they might actually approach the parent and try to intervene or talk to the parent or distract the parent or the child. When we asked them, so this is kind of what they did, they sometimes they notified a supervisor, but contacting security was pretty common, but talking to the parents, at least for the direct care staff, was common, not as common for other staff. So this suggests that staff are definitely seeing it in the hospital, but they don't always know what to do. And that because they don't know what to do, that might impede them from intervening and preventing the hitting from escalating. And so we asked the staff who didn't intervene, why not? And you could see things like, didn't where the parent become more abusive. So that's a pretty common thought. I was not sure what to say, hitting their child. Important, because then that gives staff a policy that they can, that you all can rely on and say, this is the policy in our medical center. We don't allow this because it's not safe. Let me see if I can help you. Can I give your child a toy? Can I give your child a snack? Can I give you a break? You can go out, have a smoking break with your child, whatever it is. You may need help from staff to try to de-escalate their kind of feelings of stress. Because obviously being in a hospital is a very stressful experience. So how can medical settings be a context for intervention? There's a few ways that have been tried so far. These are three methods that have been used in medical settings, typically in pediatric clinics. There's the Play Nicely program, which was started by Seth Scholler at Vanderbilt Hospital. And that is an interactive program. Parents come in and they get a laptop and they get different scenarios and they click on different kinds of discipline and learn about which ones are good, not so good, and bad. Falls into the bad category. And that's been effective at reducing parents' use of physical punishment. There's something called the Video Interaction Project, a VIP. Again, parents view video, this kind they view kind of a video interaction of themselves with interacting with their child, and then a trained, usually it could be, I think in this study it was residents, but it could be social workers, talk to the parents about that interaction and things that they could do better. And that's pretty intensive. I mean, to kind of video parents and then sit down with them and say, these are things you're doing really well. Look how great you're talking to your child, and you're making eye contact and you're smiling at them. But when you raise your voice here, that makes the child scared. You see how they got scared, and the parents can actually see it, because it's hard for them to see it in the kind of real time sometimes. To see it on video sometimes is more impactful for them. So that intervention has been found effective to reduce physical punishment. There's also the SEEK program, which screens families for risk factors for maltreatment using a survey of parents. And then a resident or a social worker will work with that family to identify sources of stress and how they might be able to mitigate those sources of stress, and talk to them about disciplining their children in ways that don't involve physical violence. So each of these has been done. It would be hard to do these on a large scale, obviously, but each of them has been tried and found to be effective in clinics. But no-hit zones are a kind of new intervention that's been tried in the last several years. And as you hopefully know, they prohibit hitting of any kind, as Nancy said when she read the little blurb for your medical center. And so typically, staff are provided online or in-person training. And so they did kind of a PowerPoint presentation, either in person like this or online. And the hospital's position is made very clear, but also importantly trained on how to react. What can you say? What can you do when you see a parent hitting or threatening to hit a child? So saying, I'm going to whoop you, that's just before the hitting's going to happen. So you could actually prevent it from happening in the first place if you can intervene. And so again, trying to distract the parent, trying to distract the child. Usually the kids are bored out of their minds because they're the siblings of the patient. They don't know they don't have anything to do. And so if you can give them a coloring book, if you can give them a task, can you help me with this? Here's a snack, anything to help give that child something to do, and then give the parent a break can help de-escalate that situation. And so the goal of no-hit zones typically is to reduce violence in the hospital, so it's not occurring in the hospital, but also by doing that, educating parents about the harms of physical punishment, so that hopefully they will start to internalize that maybe I shouldn't use this at home either. And going back to what I said about physicians and medical staff being trusted sources of discipline advice, if they hear from staff that the hospital doesn't want us hitting our children, they will think about that at home with them, and when they have that urge to hit their child again, they might think twice about that and try a different method. This is a poster using the Gunderson health system. And so they want to have this big message, hands are not for hitting. And so you can see they have hands doing other nice things, being friendly, comforting to other people. And so their message is tell others what you want to see rather than hitting them, hitting or spanking. And so that's important. They've got hitting or spanking there. Has long-term negative effects and sends a message to others that violence is okay. So they're kind of giving you the message why this is not a good idea, why I want to try to avoid hitting. And so the Gunderson put up all over their hospital. They put them in hallways and elevators and pediatric clinics, and I think they put them in several other departments in the hospital. And so I worked with Gunderson to evaluate their no-hit zone to see if it was changing people's attitudes and behaviors. And so 6 months after they started, we did a survey of staff. So we did a survey before, and then we did a survey after. And so after the no-hit zone had been in place for 6 months, staff were significantly less likely to agree that spanking is a normal part of parenting. So they learned that message. They're less likely to believe that parents should be allowed to spank or hit children in the hospital. So before that, a proportion of them thought that would be fine, and now they realize that would not be okay. They're also less likely to think that their coworkers think spanking is a normal part of parenting. One of the things we found is that staff tend to overestimate how many of their peers think spanking is okay. So if you think everybody around you accepts that behavior, you're less likely to do something about it. And so people have a misperception about how many of their peers think it's okay. So if you can educate them and say, actually, not that many of your peers think this is okay, then that makes people feel more comfortable about intervening. They realize they're not alone, that other people agree with them, and that they're part of a culture and a community that now is going to try to intervene when parents are about to hit their children. After the no-hit zone, the staff were more likely to agree that spanking is harmful, that staff have an obligation to intervene, that it's appropriate for staff to intervene, particularly when parents are spanking, slapping, or using a belt or some other object. They are more likely to say they felt knowledgeable about how to intervene, so that's kind of a credit to their intervention, which the training program that gave staff some strategies for how to intervene, and to say they have comfortable strategies for doing that. Most staff comments were very positive. So this is from one of the staff. It gives me the tools I need to diffuse a situation and hopefully change future behaviors. Another staff member said, though it is more difficult to intervene than ignore, which is definitely true, the no-hit zone has made it easier to intervene by letting the parent know that this is an organizational policy that I am carrying out rather than my own values being placed on them as parents. So that's really key. That's why a policy like you have here is super important, because as a staff member, you can say, here is the policy. Not me. This is the administration of the hospital. As a whole community, this is our policy. This is not me judging you as a parent. This is just a very objective. We don't allow hitting. That's it. No, adults can't hit each other. Adults can't hit children. And so that makes it allows the staff to say they've got the whole organization behind them when they're intervening. And no-hit zones don't have hospitals. Obviously, they can be anywhere. As probably no smoking zones started in hospitals and then spread all over the country. So it would be great if no-hit zones started in hospitals and also spread around the country. They could be in libraries. They could be in schools. Unfortunately, corporal punishment is still legal in 19 states. In schools, you may not know that, including my state of Texas. So we could have no-hit zones in lots of places where parents might get stressed and where children are. One example is the district attorney's office in Dane County, Wisconsin. This is Ishmael Uzen, who is the DA there. We're going to hear a little bit more about that later. And so he decided to make his office a no-hit zone and to get that no spanking message out there. And so, this is the first of what I know of a government agency, government office having a no-hit zone. So that's pretty exciting. So going forward, reducing spanking by parents is going to take a lot of things. It's going to take attitude change. That sometimes takes generations to do. We're going to need behavior change. We're going to need parents to stop hitting children. And we need all of us to be willing to intervene and educate when parents are hitting or about to hit their children. Hopefully, someday we might have policy change. I've been working with several advocates around the country to try to get physical punishment out of schools. Getting it out of homes in the United States is going to be difficult legislatively. I think we're very far from being able to do that in the U.S., but I'm really hopeful that we can get it out of the schools because 200,000 kids are hit in schools every year by staff on purpose. So all of this is going to be a slow process, but progress is being made each day. And so this is my email address. You're welcome to contact me if you have questions. And I'm happy to take some questions right now. I think we've got some time.
Well, thank you, Dr. Gershoff, and that was wonderful information and reinforces a lot of the reason why we implemented a no-hit zone back in March of 2016. So thank you so much. So we'll take some questions now, and for those of you who want to stay for the no-hit zone and haven't registered, you're welcome to register also and stay with us today.
So thank you for the talk. It was very interesting and very important, I think, for children all over the country. One of the things I always have a question with ACEs and with linking childhood interventions by parents into long-term outcomes is whether this is an underlying, like spanking is an underlying outcome of parents' inherent, for whatever reason, natural inability to cope with complex situations, and that results in physical outbursts of hitting, and whether their children just inherently have those underlying, inabilities to cope with complex, high emotional situations. Do we have any good limited studies that have good controls, say a child who was removed, like siblings who were removed where one had a longer duration of hitting and then the other had not, and they noted one had lower incidence of mental illness or lower incidence of poor outcomes versus the one that had less had better long-term outcomes?
So a colleague of mine I recently tried to do this with an adoption study, so kids who are adopted to different families, and we didn't find, the results are very mixed. So we've tried it, and we're going to try to find another data set. I think the sample size was too small there to really find things. So the real trick there is trying to identify, okay, what's the genetic components? Just super aggressive themselves and have so low self-regulation, do they have kids who inherit that ability? And so maybe it's that, not the spanking, that's leading to this increased aggression in kids. And so the ways we can do that are really more statistical, since there's not that many examples of kids being reared apart other than these kind of adoption studies. And so what we can do is this method I call propensity score matching, where we take families who've spanked and not spanked, and we match them so they're exactly the same on education level, on country of origin, religion, on all these different factors, and then say if spanking is the only thing that's different between them, does it still predict changes in kids' behavior? And it does. And that's as close as we can get to an experiment. There's also been a few experimental trials of parenting interventions that are geared at reducing physical punishment. And so they've been able to show when you randomly assign to these parenting interventions, parents who reduce physical punishment because of the intervention, their kids have fewer behavior problems. So there was some random assignment, at least the intervention. You can randomly assign them to the spanking, but you can randomly assign them to the intervention. So that's a little bit closer. That's about as close as we can get so far. I'm still trying to find a good data set to do the kind of adoption true genetic study. But the only study I know of so far it has found that there was some genetic component to the kids, the link between spanking and aggression, but doesn't explain the whole effect.
We have one over here.
Hi, thanks very much. My name is Peter Scal in general pediatrics. I've been caring for children in challenging social situations for 20 years and seen thousands of children who have been abused and neglected, and I so appreciate the work that you're doing. Thank you very much. I want to be devil's advocate because that seems to be my role here, and ask you a little bit about. Well, let me frame this. I recently read The New Jim Crow by Nancy Alexander, in which she proposes that American policy is often a reaction and intends to continue the current systems which we live, including the oppression of other minority groups. And I'm wondering whether there's a parallel here to the approach that says let's make policy and criminalize this behavior that may be out of proportion to what needs or the inappropriate response. And are we actually maintaining this experience by setting these policies, alienating populations that need our help? I'm not just talking racial, ethnic.
A couple things about that. So one, I mean, there's nothing inherently about children, physical children, that would make them react differently to being hit, right? Like, we don't say that about adults. We don't say that different colors of skin, you're going to react differently to being assaulted in a bar, right? We don't say that. We don't make this kind of judgment that violence in a certain cultural group is acceptable for certain ages of children. We only do that for children. Why? And that's I find that a very strange argument. I mean, if anything, we should be protecting children and giving them more protection. So for me, it's kind of an equal rights argument. Children, regardless of how they look or where they were raised, they should all have the same rights to protection from violence. And as you saw, everybody is hitting. It's not that it's just one group of people. But, well, we are with schools. We are with schools. So if you look at a map of where corporal punishment is still legal in public schools, it's the South.
Including Texas.
Including Texas.
Yep.
You know, so the main states where physical punishment is happening is Texas, Alabama, Missouri, Louisiana. So it's the deep South where we still have, and corporal punishment is happening in a disproportionate way in schools. African American children, boys, and children with disabilities are hit more often than their peers. So in the schools, we are seeing a perpetuation, unfortunately, of what I think are some racist practices in schools. The kids are being singled out for really harsh form of punishment, even sometimes for the same behavior, that African American children will get the harsher punishment. So I think schools really need to look carefully at that. So I think Jim Crow is alive and well in some of the schools. For parenting, I'm not as sure about that, but definitely for school corporal punishment.
And just to interject a little bit, if you could separate criminalization from it, would policy actually help educate? And when I was in Sweden for an international child abuse conference, they talked about how once they did sort of say that we aren't going to allow corporal punishment, it took 3 generations. And then by the 3rd generation, you had families that no longer thought that spanking was sort of an alternative to other forms of discipline, and it had disappeared from people's ideas. And took 3 generations, but you have to separate criminalization. But we should move on to, there's a lot of other questions popping up too. Yeah.
Same thing with drug treatment, right?
Yep, exactly.
And none of those countries put people in prison.
No.
None of them, and almost always it's in the family code, not the criminal code. So as Nancy said, these are educational laws. Just like no smoking zones. We don't put people in prison for smoking in a non-smoking zone, right? It's an educational thing. The whole reason no smoking zones work is because as a society we've all agreed, when we see that sign, we're not going to smoke here, okay? And so that's what a no spanking ban, it's the same thing. It's kind of a community saying, we're going to agree not to do this. But there's no parents are not being put in jail. That's not happening in any of those countries.
Thanks for the excellent talk. I think that's also been shown with regard to car seats. I remember when we were discussing booster seats here, it was shown that people look to the law to know what's acceptable and what's a good idea. And so making it the law to use a booster seat made them go, oh, I should do it. And I think that could happen here too. But my question is, has anyone looked at the experience of parents who've been corrected on this, for example, in a no-hit zone? I think it would be hard to do, but I'm wondering if there's any research to guide best practices and how you approach them, for example, because I could see that that would tend to make people very defensive, and sometimes if you feel challenged about something as personal as parenting, especially in a public place, you could be very unwilling to learn from that interaction.
Yeah, and so no-hit zones are still fairly new, and we don't have, there's not like a codified manual yet. There is a website called This is a No-Hit Zone that Gunderson Medical Center runs, that they have some educational materials and guides for staff and things like that, and they have kind of suggestions for how to do it. We don't, I mean, there is the chance that you would get a negative reaction from a parent, for sure. Just like if you're trying to break up any kind of violent situation. And so I think it's a great idea. I think that the hospitals that have no-hit zones, it'd be great if they all kind of got together and created something like that. I'm actually going to be on a call tomorrow, I think, with several no-hit zone hospitals, and that's something that we're trying to do, is trying to make something like that. So it doesn't exist yet, but it'd be really important to have that.
Great talk. Thank you so much. The prevalence and ubiquitous nature of spanking across cultures and human history is remarkable. And it gets me to wondering, do primates spank their young? Are there other mammals that engage in corporal punishment? Is there any evolutionary significance to this?
I've wondered that too. They do. I think they're slapping, hitting, kind of physically moving. I don't think they necessarily hit a child on the behind the way we do. That's kind of a thing that humans do. But there's definitely slap, this kind of stuff. So yeah, we probably, there is some. I mean, people have been doing this for years. And humans solve lots of conflicts with violence. Like that's just. There is some kind of inherent, unfortunate way that humans solve problems with violence. And so parents have been doing it at home for a long time. So yeah, that'd be interesting. I have to think if there's any other research about that, but that's a good question.
I'm going to take one final question over here and then wrap it up.
I just was wondering whether or not you did any research to discern the role that economic class had to do with all of those particular groups that you had listed there. And secondly, I just want to raise a comment about, particularly amongst Americans of actually of all groups, one of the things that I've seen, and I've worked in a number of hospitals in Chicago and so forth in pediatrics, one of the things I've seen too is that more education obviously makes a big difference. But also in the same way African American eating patterns have changed since slavery, our method, because we're not picking cotton in the field, we don't have to eat that heavy food anymore, but that's changed significantly with education and saying that this is the way we ate then because this was the way to survive. Similarly, I am of the argument, and I think couple other sort of theologian scholar types are thinking that with regard to spanking and whipping, that was done by families in slavery times, particularly because to prepare kids for the cruelest of all beatings that they would receive from the larger society, from their owners. So it was a preparation for that because you're going to experience much worse from the people that own you than you are from me. So to get people used to the idea of always being beaten and oppressed was part of the rationale, even though, obviously it's a horrific notion. But I just want to lift that up, and more I'm interested in the class issue.
So for that question, we did control for education and income in those analyses so that those are kind of out of the analysis. We did do some analyses looking at SES and education. We didn't see a lot of differences, that you see negative outcomes regardless of SES. So whether the parents have high education or income. But in the race and ethnic analyses, we did control for that. So your question about slavery I think that is unfortunately true. It's hard to prove that, And so it makes me really sad to think that that is a legacy of slavery and that families today may be still doing it because that mindset's been passed down. The kind of more modern equivalent is parents will now say, well, it's because I live in a really dangerous neighborhood. And I want my kids to be polite to the police, and I want them to, listen and, know that there's really negative consequences out there. But unfortunately, the research doesn't suggest that it's more effective when they live in negative neighborhoods. And so, I support the parents' goal for sure, and I can't imagine what it's like, particularly to raise an African-American boy today. Like, I just can't imagine what that's like. But unfortunately, spanking is not helping that boy. It's not helping him learn self-regulation and things like that. He might be learning that other ways from his parents. They might be teaching him all kinds of other ways. The spanking isn't what's teaching them. And it's really hard to show that to parents. And so, we look at it with data, and so we can find it with data. Parents can't see that in their life because the kid might be adjusted fine because the parents are teaching them and taking them to church and all the things that are going to teach them moral development. So, but we don't have data to show that if you live in a dangerous environment, spanking's better for you. There's no data to support that. But I think that belief is very prevalent. So.
Well, thank you. And thank you for everyone who attended Grand Rounds this morning. And please take these messages back to the families in your clinic. And if you're staying for Grand Rounds, we're going to have a break. So we'll be back in 15 minutes.